Are you an older Jewish queer and/or trans person who requires 24-hour nursing care? Whether you have been living at home, in a retirement community, independent living, assisted living, or are in the hospital, all long-term care admissions are done through either a community case manager or a transitional support team member. If you are in the hospital and no longer need medical treatment but cannot return to your home, you will have priority in accessing a long-term care bed. You won't be able to choose initially which home or facility, but you will be able to request a transfer to your preferred location. What important considerations do you need to make as a Jewish queer and/or trans person at this stage? There are no LGBTQ long-term care options in BC, but Harrow Park has been known to be LGBTQ friendly and was established by the Vancouver Jewish Building Society and the Netherlands Society. It offers independent housing, assisted living, and long-term care. There is one Jewish long-term care option in BC, Vancouver's Louis Brier Home and Hospital, next door to the Weinberg residence. Admissions to Louis Brier long-term care beds is done through Vancouver Coastal Health's Priority Access Program. Louis Brier is obliged to take any patient awaiting discharge from the hospital who needs a long-term care bed. For example, if there is a choice between a non-Jewish hospital patient and a Jewish hospital patient, the Jewish patient will get the bed. But if it is a choice between a non-Jewish hospital patient and a Jewish person in the community, the non-Jewish hospital patient will get the bed. In addition, Louis Brier is obliged to give every third available bed to anyone in the community considered to be an emergency. Other than these requirements, Jewish individuals have priority in accessing beds, provided they declare they are Jewish, require a Jewish environment from a cultural and religious perspective, and eat only kosher food. The cost is means tested based on your previous year's tax filing from the previous calendar year up to a maximum of $3,800. If a bed is not available at Louis Brier, you will go into another facility and can request to be placed on a transfer list and wait for a bed at Louis Brier. The current transfer wait list for Louis Brier as of November 2022 is 50. People outside of Vancouver can look at private bed options at Louis Brier. The Louis Brier staff and senior management have not received LGBTQ competency training, but are open to discussing this further with JQT. There are no openly identified queer or trans residents at the Louis Brier. We know of one closeted individual who is disclosed to another Jewish organization, but not to the Louis Brier where they live as of December 2021. We reached out to an employee of Island Health, and to their knowledge, there are no facilities that have a higher density of LGBTQ residents, nor any with a higher density of Jewish residents. There has been talk in Victoria for decades about creating a Jewish seniors facility, but it is unknown if any organization is still holding that thread. The level of Jewish and LGBTQ assistance that you may need versus the level of cultural and LGBTQ competency that a long-term care home has may not be sufficient for your needs. You need to give this careful thought so as to prepare as best you can. For example, many care homes have only shared or semi-private rooms. Would you be comfortable sharing a room with someone who may or may not be LGBTQ or Jewish inclusive? Would you feel comfortable making inquiries about this? Do you need to find a long-term care home that has only private rooms? Please note that this video highlights the main points covered in this section. To access the resource guide in its entirety, please visit www.jqtvancouver.ca. The next video will cover information about moving into palliative or hospice care.